co-presented this time by Spring and Startup Vancouver. We'll introduce everybody on the call in just a moment, but quick mention for those of you who are joining on Facebook Live or on YouTube or something recorded after the fact. Take note, go to our website, entreflow.com. If you want to get in on this chat right now or on the next one, you can go to that link. It's handy on our homepage, join quarantine chats, and you'll see all the joining instructions. You can get in there right now or join for the next session. The agenda today, we're going to, as usual, run through the news, any updates that we have. We're going to go into some topics about bringing people back into the workspace today, and that's going to take a couple of different flavors. Through this whole thing, we really love to have your questions. It's meant to be a chat. We've got a lot of voices on the call today and a lot of great expertise. And so we'd love to have your questions as you go. There's a few ways that you can do this. So one is you can open up, should be on the bottom of your screen if you hold your mouse down or at the top, depending on how you set it. There'll be a Q&A feature. There'll be a bit of ability to raise your hand. We love it if you raise your hand and we can open up your microphone and you can talk about your particular case, ask about your question. We'd love to hear that too. And otherwise, type it into the chat. There's a setting that you should put on, and I see that most people have found it, to set it to all panelists and attendees. So when you type in your message, it'll go out to everybody who's on the line and everyone can see your question. We'll try and get to questions as they flow through the topic as we go. So, but first up, let's welcome on a few people onto the call. We've got Keith and Collins are co-presenting with me today. So Keith, do you want to say a few words about yourself and about Spring, and say hello to the audience?
Yeah, for sure. Thanks. Welcome everybody. Really excited to be here. My name is Keith Ippel, and I'm the co-founder and CEO of Spring. We exist to change the world through entrepreneurship. And so, as you can see, we love to create an impact. Wore my right t-shirt for today, which is great. So I'm a 4-time entrepreneur. This is my 3rd time running a business through recession. Spring does work, early stage entrepreneurship, not only in Vancouver, but in about 35 communities around the world. So just really excited to share any questions, comments, and discussion with you all today. Thanks.
Sounds good. Thanks, Keith. Colin, you want to say hello and a little bit about what Startup Vancouver is?
I will. Thanks, Ian, and good to see you again, Keith. My name is Colin Weston. I am the community leader for Startup Vancouver, and Startup Vancouver is one of almost 50 community chapters of Startup Canada across this great country of ours. And Startup Canada is the voice for the over 3 million entrepreneurs in our country. And very, very happy and proud to again collaborate and co-present quarantine chats with Ian and the Entreflow group. Great to have Keith on board now too, with all the good things they do with Spring. And we also do our own events, and in fact on Tuesdays and Thursdays, and at 12:30 after people finish up here, you're more than welcome to join us for our live stream show, our half-hour show called What Keeps You Up at Night? Entrepreneurship During Challenging Times. We have 2 great entrepreneurs today on with us for a half-hour show. So please join us with that. In chat, I will put the link to that for afterwards. So Ian, thanks again for having us on.
Great, thanks, Colin. And of course, I'm Ian Rogers, founder of Entreflow Consulting Group. I'll probably be talking a little bit today, so I'll try and keep my introduction brief. I actually put a little slide together so you know what Entreflow is and what we do. Basically a boutique consulting firm for high growth companies in Canada, offering accounting, HR, and marketing services. And we decided to put on quarantine chats to help small businesses and startups and high growth companies through these interesting times. So, but let's get to our panelists today. So we'll start off with Dr. Natalie Chan. Can you say hello to the audience and a little bit about who you are and what you do?
Hi there. So I'm Natalie, and I wear a couple hats. So my first hat is I work as a family physician here in Vancouver, BC. And then my other hat is I am the president, research director, and co-founder of Be the Change Group, which is a population and public health consulting firm here in Vancouver.
Thank you, Natalie. And Brandy, can you say hello?
Yeah, my name is Brandy. I'm the CEO and creative director of Be the Change Group. As Natalie mentioned, we are a creative and consulting firm in Vancouver. Of course, we are very busy during these COVID times, so we're happy to share some of the experience and knowledge we've learned over the last couple of months.
Sounds good, thanks. Bronwyn, the only person here with all caps on your name, sorry about that. Go ahead, can you say hello?
Hi guys, yeah, so I'm the HR practice manager with Entreflow and head up the HR consulting and recruitment practices for all of our companies across Canada here. So, super excited to be here today.
Great. Last but not least, we've got a regular on the call. I forgot to put his card up, but it's Dustin Meneses, and I've probably said that name wrong, I'm sorry, from Payment Evolution. You want to say hello, Dustin?
Yeah, absolutely. Thanks for that, Ian. I appreciate it. And you weren't that off. It's Meneses, but again, Dustin Meneses from Payment Evolution. I'm the senior manager of sales over at Payment Evolution. We were the first cloud payroll solution in Canada, but we do an array of different things from benefits, similar things with HR as well, and helping a lot of the small businesses in Canada. So really know a lot of about the Be the Change and the startup Vancouvers and the startup chapters and stuff. So excited to be here. Thanks for having us.
Great, thank you. Let's get into the news. Okay, there was last week a comment about the RRRF, and so I promised to put up a link for that. So it's right in there. This is meant for businesses that didn't qualify for CEBA, who are in remote regions in Canada. So there's the link. It'll be on the slides afterwards. Check that one out. The other news that was announced just late last week, just as we were getting on our chat, was about the CEBA eligibility. So they've opened up that qualification criteria again. So now there's some more businesses that will qualify for that. If you didn't qualify for CEBA before, go check it out again. You might get access to that $40K loan backed by the government. With a 10K of that forgivable. Go check it out again. If you didn't qualify for that, you might get to it again. Also, as of yesterday, the KECRA, the rent relief program, has been released. So if you are a landlord, or you pay money to a landlord, you might want to make sure that they are following through with this program and seeing if rent relief can be applied in your case. There's a link there. The landlords have to register and then apply. It's a two-step process, but shouldn't take long. I won't go into the details on this because we talked about the KECRA a couple times before. If you missed it, go check out the recordings of the previous slides or all the resources online, and then just go ahead and see if that applies to you or your landlord. I wanted to bring up some stats. So to set the context for today, we're talking about some massive changes. We had a huge, massive change in the way that Canadians are working. So this is Stats Canada data from March. So I expect that these numbers will be even higher based on April and even May data. But as of March, 40.5% of businesses had laid off employees, and 45.2% of those had laid off 80+% of those employees. Almost half of businesses are working remotely, working online, which is more than doubling from the previous month. And then we've got a huge number of Canadians who are on reduced hours, away from work, etc. So when the government talks about opening up, making businesses, allowing businesses to open up and having more interactions in the workspace, this is a huge shift. So that's the magnitude of the problem that we're going to try and tackle today. And I hope that Bronwyn is and Natalie and everyone else are up to the challenge to guide us through this. I had this slide, which is some positive news. I always like to round it out with positive news. So this is actually a repeat from last week, and I'm just putting the links up again because I think some people were asking for them again. We've had some vaccines approved or going going into clinical trials, approved for clinical trials, I should say, or going through the first stage of clinical trials for COVID, and the business environment responding to that positively. So those are the links there. And there's also some nice stories from our community too. We've got a nursing home in PEI. Their residents were sort of holed up in there and really missing their families and really missing their Tim Hortons. So they had their local Tim Hortons come in and set up a Tim Hortons right inside the facility there. So that was a nice story. Out of Ontario, we had a university student start to rally their community to 3D print some personal protective equipment. So that was a cool little story from Queens, where I went to for my MBA. And a local company, Isle, which I didn't recognize at first, but then I realized they used to be called Lunapads, and I recognized that name. So they're in the downtown east side, and they were getting lots of requests for, hey, can you make cloth-based masks? And so they made a quick pivot and got some community engagement going on, and they've produced a couple thousand cloth face masks for people to wear. So those are some good stories. I'll pause there. And is there anyone on the panel that has any other news to share that I missed?
You did such a good job of covering some good ground there. I don't know if I have anything that I would jump to add to that. Just anecdotally for everybody globally, because we've been talking to people in Asia, Central America, and Europe. Interesting to see the different reactions and responses. A couple of Asian countries have already gone through what they are calling their second wave of COVID, which in their particular context being, by the way, both Cambodia and Hong Kong, the size and scope was dramatically smaller than the first wave. So hopefully that will be true for other places. Europe is just starting to open up. A lot of these challenges and a lot of these good news stories are very similar. So it's just good to know that we're not alone in all of this.
Very cool. Thank you. All right. I want to turn this over to Bronwyn to lead this next little bit. And we'll jump in as we have questions. So go ahead, Bronwyn. Broader context about bringing people back to the workplace. What should we be thinking about?
Yeah, thanks, Ian. So just a couple things, we were thinking about kind of top tips for bringing people back to the workplace, and what you should be thinking about now in preparation for that, putting your plan together, or maybe if you're not ready to put your plan together, what you can do to start preparing for bringing people back into the workplace. One of the things that kind of first came to mind is if you do have your employees that have stayed and worked throughout this time, it's a great time to kind of give them some sort of appreciation, check in with them, see how things are going. If they've had to have a pivot in their position since COVID's kind of hit, are they liking it? Are they not liking it? Do they need to go back to the position they were in previously? Kind of just check in, look for some disengagement hints. Maybe there's some like low productivity, there's a little bit of low productivity. The quality of work isn't exactly where it was before. Just kind of check in with those ones that have stuck around. This time has been very stressful. Lots of uncertainty kind of all around it. So just it's a good chance to check in with everybody, maybe perform some mid-annual reviews or quarterly reviews at this time. And then for your furloughed employees, so anybody that was laid off during this time, if you aren't kind of communicating with them already, now is a really good time to reach out and just see where they're at. We've said before to, don't set the expectation, or, don't expect that everybody's going to be coming back from the layoff. You may have people that weren't already happy kind of with their position that they were in and maybe already searching for jobs. So check in with the people that have been laid off, see if they are looking for work. Have they gone and gotten work elsewhere? Are they ready to return? If you have the opportunity to do kind of a little bit of a staged return, it's a good chance to kind of get a pulse check and see who's ready to come back and who's not. Just like a side note, we did a poll for our team internally, and we were very surprised to see that most people are not ready to come back to work into the office yet. So we've been all working from home for the past couple months, and we thought that everyone everybody was going to be really anxious to come back into the office, but really right now nobody's quite there yet. So remember the employee's right to refuse unsafe work. So that's covered by WorkSafe BC. We can add some links in there just to kind of check all of that out. But you really do have to, if an employee is saying that they're not feeling safe in their job, due to exposure or closeness to other employees, being sure that you're working with the employee to create a safe environment. Roles and responsibility changes. Yeah, so if there was pivots or will be pivots that you're going to be putting in place for the organization, just ensure that that's been communicated to the team, it's been talked about, and that, job change letters have been written up or brand new contracts, depending on, if you're switching somebody from, let's say, an administrative position to a brand new department, brand new job position, like a bookkeeper or an accounts payable clerk, might be a good chance to do a brand new contract at that point versus a job change letter. Number 5 there, policy changes. Look at your current sick leave. I know that I saw earlier this week that Justin Trudeau is trying to push for 10 days of paid vacation across Canada as a new policy. So we'll see where that kind of lands here. But right now in BC, it's 3 unpaid days of sick leave is what is regulated. So if you don't have something in place right now, maybe it's a good chance to kind of update that policy just to make sure that the team feels as though they can take sick days if they are kind of feeling a little bit off. And when you are returned to the office, that you're not increasing the exposure risk to the team there. Other policies that you may want to look into is, if you have moved your whole team to virtual working, do you have something in place for that? And, working hours, and there's a huge list of things that you should be looking into. And if you don't have a policy manual at all, it is also a great time to kind of maybe think about putting that together. The other thing that you need to prepare for bringing people back is your culture shock part 2. You probably if you move to remote or move to layoffs, there's going to be the culture's not going to be necessarily the same as when you were in the office originally. So just prepare for that, prepare for some team building exercises, prepared for some, continue with your culture. Like activities that you were doing if you were all virtual. So, we've talked lots about town halls and one-on-ones and check-ins, just kind of keep those going. It'll help with trying to stabilize the culture a little bit and not as high risk for kind of creating you could run the risk of it going negative. So just try to keep things going there. And last tip that I've got is team building. There is lots that you can do still with team building, even if your team is fully virtual. So I've seen some cool things online, such as a team building exercise for listening skills, and it's a virtual blindfolded origami. So I thought that was kind of cool. I totally want our team to try this one out and see how that goes. But you don't have to be all together in order to do team building exercises. And I think, especially if you are losing some team members or gaining team members, this is a really good time to kind of put something in place here to get everybody back on board. My top tip, though, that kind of encompasses all of this is just communicate. So make sure that your team knows what's going on, make sure that they're involved in the conversations, and make sure that they are kind of engaged with what's going on. And that's really quickly what I have to add for today.
Cool, sounds good. And if anyone has questions for Bronwyn about HR policy manuals and stuff like that, then please type it into the chat. If you've got a fun thing that you've done with your team to re-engage, or something you're planning for team building, then again, please type that into the chat. We'd love to hear some more of those things that are coming up. Great. I'm going to, this is the statement, there's no back to normal, right? So in this context, I think really important for everybody to keep top of mind that it's not going to be a return to the old ways. It will be a new normal. And here's some of the consequences of not taking action or thinking that it will be, that we've just put up in there. So Bronwyn's tips, I think, are really important for this. I'm curious if anyone on the panel or on the line has felt that maybe they're starting to see some of the edges of these sorts of things happen, or if anyone's got anything fun that they're planning on doing with their team. Anyone got anything?
The one thing that I did forget to add, and kind of ties in with the if you don't take action here, is for those people that have stuck around and that you have still had work throughout this time. One thing that we've decided to do to kind of help with thanking our team and giving our team a little bit of a break is to close down the office for a week and allow everybody to have kind of some vacation time all at the same time, uninterrupted. And, that'll, hope to give them a little bit of a break there. But, and that's really because the team, and, what we see with a lot of teams right now is there's high burnout risk still without these breaks in place. And not everybody feels comfortable to take vacation right now. So maybe a little bit of a forced vacation might be beneficial to your team to just help with resetting a little bit.
Well, sounds good.
I was going to say, I really like that idea also, because Ron, when we're about to get into the phase where nobody has taken their holidays and they don't plan to. So we were just talking about that with our teams, how I don't want everyone taking holidays in October because a lot of them can't cross over. We're a small core team of 8. So I think that's a really good idea, maybe to get them to collectively to choose a week where they all want off together.
That's kind of a cool idea. Yeah, I'll share a couple things. One is I actually put a free webinar in kind of masterclass, if you will, in the chat on Thursday about work stress, balance, and burnout. It's actually led by a psychology startup, and it's very specific tools. And it's actually a session run by therapists. Definitely worth checking out if people are either feeling burnout directly on this call, or if you're sensing your team is feeling burnout. So do check that out. On our end, and I'm just going to make the observation, like when we went to lockdown as a team at Spring, and we're a team of 11 people, our productivity went up dramatically over the next 6 weeks, pushing 8 weeks. And during that time, we saw tremendous work, but then we saw that kind of fraying at the edges, right? And so for us, I think it's been a combination of things. One is actually doing things like virtual meals together, has been one part of it. The second one is, we actually did give everybody a day. We just gave them a day. We just said, go take a day, Friday, which was a bonus day. It was not scheduled vacation, but you know what? People needed it. We gave it to them. And I think there was a good amount of gratitude for that, and just an opportunity for people to create space. So I think we're still learning as a team how to work in this kind of mostly at home kind of world that we're in. But those would be the observations that I would make, is we need to increase more social time online as a team. And we need to just kind of acknowledge the team had been really pushing hard, and we just need to have a bit of a release valve,
Super good. I love that. I love the conversation. And I think that it's going to continue, and we're going to see some more shifts as people start to come back into the office in one form or another, is just recognizing that it's going to be weird, right? It's going to be not a usual way of interacting. And so we're going to have to be really conscious about how we reintegrate back into the workspace, especially as some teams are doing sort of rolling schedules or, reduced days or time in the office, and still having a lot of virtual working. So we're going to have to, I think, continue these kind of conversations. I'm going to put this slide up here, and I think I'm just going to save it for for people to review after, because there's not that much to talk about here. But it's just that, hey, you need to know that there's employees have a right to refuse unsafe work. But maybe let's get into more of the how do we make sure that things are safe at work. And so for that, I'm going to turn it over to Brandy and Natalie to lead us through this discussion. And thanks so far for everyone for putting things into the chat. Love your questions and comments as they come. So keep them coming, please.
Thank you so much. So just so everybody knows a bit of our situation, we do have 8 core staff, and then at any given time between 8 to 12 consultants working for us. We have 21 on roster. We have stayed, 4 of us stayed in the office and 4 worked from home. We are a population public health firm, so Natalie did the first COVID session as early as January for the team. So we were watching the pandemic before it became a pandemic, essentially. So we definitely come in with a little bit more knowledge and understanding about how keeping ourselves safe. So that was a decision we made. All our team is back now except for 1. So I want to talk to you a little bit about things to do for measuring your team. So we've done this with our team, and we've also worked with clients to do this. So the number one, I know, Brian, when I'm going to repeat some of the things you said, hopefully it complements it, is a survey. So I think this is a really quick and easy way to do this. We've done pulse surveys. We've done 5 questions and then larger ones with our clients. These are also really good for larger organizations that can't maintain privacy. So if you have a small team of 8 to 11, it's easy to know if you only have one mother, for example, and she talks about children at home, you can identify. So it's great to maintain privacy to have a survey. So we also recommend using a third-party data collection that can take away any identifiers. And really you're looking for questions about how they're feeling overall, how they're feeling about coming back, where are they getting their information, news from. We thought this was a really important one because you can get a litmus test of if people are looking at the right sources, because there's so much misinformation out there. I think we need to understand that we hear it, I'm sure, around, especially among, for me, my parents, talking about, oh, did you hear this or did you hear that? And I think that you need to really understand where people are getting their information from so you can start to debunk some of these myths. Understanding barriers, which could be a family situation, access to childcare, they don't want to take transit, any of the things that are making it nervous for them. And then, of course, input on policies. I'm going to be really clear that if you are bringing a team back to work or you are not working on your policies, I think that this is a really big problem as an employer. You need to have some policies in place. And also there's obviously Workspace guidelines that are expected this. But this is important to have a safe workspace, which I'll let Natalie get into that because that's her area of expertise. Then I think it's important for everyone to understand that you need to meet everybody where they're at. So this is really important for understanding
Brandy,
that
can I just interrupt? Can we just go on the next slide? Thank you.
Thanks, Anna. Yeah, thank you. So what does physical health and underlying conditions? So there is people who have underlying health conditions that don't necessarily talk about them, or maybe they're on medication that's immunosuppressant. So I think it's really important to understand that there may be these issues and there may be people and they maybe not want to disclose to you, especially if you're a small team, or maybe if you're a small team, they do. So really important to consider that. I won't go into mental health too much because I know we're hearing about this a lot, pre, during, and post. But something to consider, of course. What does that look like? Next thing I want to talk about is possible traumas during the pandemic. So people have to realize that we're looking at possible loss of loved ones. There's been a dramatic increase in domestic violence in homes. So someone might be coming back from a domestic violence situation. And then also some people have been working frontline. So there's individuals like in our case, Natalie, who's a physician. So, but there's other people who work frontline for whatever reasons. Maybe they have an evening job, or they're volunteering, or they've decided to work, be a greeter at a hospital during this time. So it's good to assess if anyone's coming back with a little bit of trauma, because that may affect them differently, but they don't know it, if that makes sense. Another thing that's really important is so looking at different risks for different people. So Natalie and I have talked a lot about this, and there's different people on our team specifically, and then looking at some of our clients. So there's an easy one to think about, transportation. So somebody taking transit, as they are, that could increase their risk, especially as traffic picks up, as opposed to someone who's biking or driving by themselves. Does somebody have children? Does somebody have a busy household, or a partner who's a physician who's working frontline? That could be a situation. Do they have a second job? Is somebody working a night job in a restaurant? Because restaurants are open, and I live in Gastown, there's lineups up the door, they're getting busy. Do they volunteer? Are they volunteering at a shelter on the weekends to help out? So that increases their risk. And then, of course, last is the belief system. So some people don't really think this is real or are increasing their social circle or aren't social distancing because of whatever challenges they're having to understand or cope with the pandemic. So it's really important to think about what you're going to do in a workplace when you know somebody is what we consider like high risk of exposure, and how you're going to manage that. Are you going to ask them to come home? Are you sorry to work from home? Things to think about for you guys. And then I think the thing too is that these things can happen, of course, by a survey. But for us, for Natalie and I, we have been creating a space to engage with our team consistently, and not just as an open forum. So this is on our agenda every week. And then we do a midpoint like mental health check-in, where it's just more of a fun thing. How is everyone feeling? What has your challenge been this week? And then also there's opportunities for you guys to have an open forum. We're blessed because we have a physician in-house. So Natalie does a Q&A with the team. And I know it seems crazy, but a weekly QA was needed, especially as information changed so quickly. I think the pace is slowing now that we have more information, but there's still new information. So maybe having something like this, an open forum with a physician, public health specialist with your team. And then of course, it's really important, doesn't matter how big your team, somebody, whether it's a manager, supervisor, or yourself, needs to touch base with everybody individually. Those are the things I think that has kept us strong and kept our team healthy. And every single week, one of the team members was having a struggle without fail. And it took turns, thank goodness. Made it a lot easier for us. And sometimes it was just listening, and sometimes it was just Natalie really explaining what the information is actually meaning. So yeah, so that's just for me what I call measuring your team, is something we've been doing. And that's really the pre-work. And then I'll let Natalie see if you have anything to add to that, Nat, and then I'll let you jump into the policy we created to continue to create that safety for our team.
Yeah, so before we even jump into the policy writing piece, because I know a lot of people are starting to do that as we're reopening here in BC and across in different jurisdictions. The one thing to keep in mind is that for us, I think what was really helpful for bringing our team back into the space as well is for the individuals who felt most anxious, most scared, most at risk. I actually engaged them in helping to write this policy. And while we were doing it, we actually talked through a lot of things for why did we do it? Why did we make that recommendation? How is it keeping us safe? And I think with those pieces where you're actually engaging them so that they can build that safe workplace together is really helpful. Obviously, it's a little bit more challenging for people who have very, very large organizations, but I think even having an opportunity to talk about why decisions were made a certain way is really, really key and important when you're actually trying to put out a policy that is impacting their health and safety. Because everyone has a right to actually taking care of their own bodies and ensuring their own health. So, and it's very different, I think, when we're talking about different other policies that are quite standard, but this is a very particular health-oriented policy. So let's jump into the next slide, and we can absolutely, so some of the stuff that I'm gonna go over is obviously stuff that a lot of people already know. So if there are other questions that are either related, please feel free to ask them. But we're going to go through a little bit of the core of how we built our policy, which I think is going to be shared after this, or has already been shared? After this, okay. Yeah, so perfect. So the policy that we produced, we actually shared publicly because we wanted other companies to be able to use it as a point of reference. We know that there's a lot of things that are being published by multiple jurisdictions, but they're not always as specific, they're quite broad. And so this is how we have applied our guidelines. So the first thing that we start off with in our policy is really just symptom screening. And the reason why we put this front and center is because we wanted it to be known to all of our staff that this is the number one step. So we're not going to talk about PPE, we're not going to talk about anything else. We want to just talk about symptoms. And for us, it's been a blanket statement that the symptoms of COVID are very vague and mimic everything from food poisoning to general migraines to just a regular cold. And so we've included every single symptom there because we know that for people who are healthy, it tends to present more mildly. And so if anyone has an inkling of any of those symptoms, we've asked them to check in with us and let us know what's going on, and then just to not come in at all, and to not feel pressured that they need to try to make it to the office or make a meeting, that we are more than happy to rearrange anything so that they can be at home and keep themselves safe and keep the staff safe. Obviously, right now here in BC, we have seasonal allergies. So that's been a really big thing, because that Brandy nose is on that list. So for anything that we think might be mimicking like a seasonal allergy, we actually are having just one-on-one discussions about the symptoms if they feel comfortable, or we're recommending that they go to their family doctor and talk about the symptoms and get a COVID test, just to have that comfort before coming in. So that's that piece on symptoms. So on the next slide, we then moved into talking
Natalie?
about, yeah.
Can I just add what your recommendation was? I believe was to take a antihistamine, and if it doesn't go away, was that the recommendation that you provided?
Well, so that was the recommendation for us, only because I'm able to evaluate our staff as a physician. I think for other places where they don't have that access, I think it's better to err on the side of caution if it's something that's out of the ordinary for your staff, and if they're at all worried. BC has opened up all testing for COVID with any of these symptoms listed. So it helps to get a test, or even just have a conversation with someone who can provide insight and information on that.
Mm-hmm. But generally speaking, it's okay to take an antihistamine?
Yeah, well, if it's a respiratory tract infection, generally the antihistamine will suppress some symptoms, but not all of it. And so a lot of people do have seasonal allergies here in BC. So we really have, you just have to have a really good conversation. Like, is this out of the norm? Like, is it worse than usual? Is there anything else that individual is feeling that might indicate that it could be something else? And so if they aren't sure, then it's just better to have them stay at home until they feel better.
And just note, everyone, too, we had to update our employee policy manual. We do have an employee policy manual that says if you're ill, stay home, because we are a public health agency. So I think it's important for everyone to review and it not be like a maybe stay home, think about stay home, but make sure there's somewhere in your policy. And if you update it, that all your staff sign, if you have any symptoms, you must stay home. And if they come in and they present symptoms, doesn't matter what they're doing, they're asked to go home immediately and their area is disinfected.
Yeah.
It sounds really dramatic, but it's needed right now.
Yeah, it's what keeps us all safe. So then we also decided to address testing and the considerations around health and testing specifically. So I'm not going to review what to do with a positive test, because that is very clearly guided by public health guidelines. We do know that people are going to have negative tests. The reason why we've addressed negative tests, particularly in our policy, is because we also know that when the prevalence rate, or the number of people who have COVID, when it's low in a population, we know that the current tests are not very sensitive, so that there's a high false negative rate. And so because of that, just because someone tests negative doesn't necessarily mean that they don't have COVID. And so how we've worked to address this is that if someone has symptoms that are very much in keeping with any kind of cold, and they have like a cough or a fever or myalgias or any stuffy nose, regardless of the results of that test, if it's negative, it doesn't mean that they can come into the office. So we've made the decision to say that let's presume that your COVID test was a false negative. And so what we would prefer is for anyone with symptoms that they stay at home and continue to work at home until those symptoms resolve. And so current health guidelines here in BC are that if you've gone 10 days and the vast majority of symptoms have resolved, other than a residual cough, people can return to work. And so that's the policy we've kind of gone with. I think our team felt more comfortable if we did it to about 14 days. And so I think this is going to change. These numbers are going to change. And so we've acknowledged with our team when we actually did our training piece that we can have these discussions ongoing, whether or not we do 10, 14 days, like what does that look like and how do we guide that? And then for anyone who is going to come back, their symptoms are gone, but they have a residual cough and they had a negative test, they're going to be asked to wear a mask in the office until that cough resolves. And that's just because while you're coughing, we just don't know if it could have been COVID, how long it could have lasted for, what else might be spreading. So I don't know if anyone has questions on that. I know it's a little bit of a tricky piece to navigate, but we just didn't want to rest our laurels on a negative test. The other pieces of the testing and considerations is we addressed health concerns. And so we know that not everyone wants to tell us about their personal health history. It's private, it belongs to them. And so we've asked that if people have any concerns, we're going to assume and write our policy. In our training, we let them know that we wrote our policy for if we had more than one person who is high risk for a serious infection, this policy should cover them. However, if anyone wanted to bring up any health concerns to us privately and let us know what they're concerned about, that we would make all of the necessary arrangements to ensure that they can have a safe workspace. So whether or not we're all in office and they feel they still have a need to be at home, or if they have other risks that they perceive and they still want to be at home, we're going to address that one-on-one on an individual basis with no negative consequences. And then we've also included a piece about vaccinations. And so while COVID's still going on, we know that when a COVID vaccination comes out, everyone's going to, well, most people will want to get one. Some people may not. But we've also just included the list of general health vaccinations that people might be interested in getting that could also further help during our flu season. So that's going to come in fall. We are preparing for a second wave at our offices. And so part of that was just recommending people get up to date on vaccinations as well, just to prevent cross symptoms essentially. Okay. So then we move into the actual physical workspace. And so I'm not sure how many people out there are familiar with the hierarchy of controls. I know that our public health, our medical health officers have brought this out to public before, but this is really the prime occupational health and safety methodology to actually reduce transmission of an infection. And so elimination and substitution are at the top there, which elimination, we haven't really been able to eliminate COVID with the lockdown. Substitution would be essentially a vaccine. So unfortunately, we don't have that. And so things that we have to, the tools that we have at our disposal are engineering tools, administrative controls, and PPE. So obviously from most effective to least effective in that triangle there. I've color coded our the things that we're talking about today in the colors that relate to the hierarchy. So when you're thinking about your actual physical workspace, what helps us writing a policy is we think about actually walk through your workflow, like your actual workflow of your space. So beginning from one, just looking at your entire floor plan. And so we actually calculated our capacity by looking at our entire square footage, minusing the percentage that's covered by furniture and like fixtures that are in there. And then that was our leftover square spacage. And so to actually decide how many people come into our office, we decided on one person per like a 2.5 by 2.5 square meter space, which is I think what WBC has come out as a recommendation too. So it's 5 square meters all in total in the middle. So one person in one of those. So if you divide your square footage by that, that's your capacity. However, that's your maximum capacity if people are standing or sitting and not moving. So you have to take into account the actual flow of your space. And so when we look at that, we actually we actually subtracted an additional 30% off that number so that we could actually account for enough flow of traffic to allow people to continually socially distance. So that's going to change depending on how your guys' space looks. whether or not you have a big open space, lots of enclosed rooms, lots of enclosed meeting rooms. So that's just something that there's no formula for it, but that's how we came up with our capacity of our office.
And if I can just add to that, Natalie, some of our clients have different challenges as we've been working with them, we've been seeing. So for example, if someone works in reception, she can't control people coming closer or not. So then that's when Natalie looks at other things like this individual should wear a mask, or this individual should, be by the barrier, which I know Natalie will talk about. But just that idea that there's different measures that come in place if you can't do that in this space that you have.
Yeah. So building entry, I'm not going to really touch on because I think everyone is aware, like most of it's hand washing and ensuring that people who are coming to your space are safe. Barriers. So again, I say if required because that's also dependent on your space. So if you have like a big office pool where it's just shared desks, you probably should put up barriers between people. For us, we actually measured out the distance between, we have an open space, but everyone is actually facing the wall and we have a shared middle space. And so we actually measured out the distance between each working space, and we've ensured that people are not crossing over into other physical workspaces. So that's kind of how you make your decision on barriers or not. Like if you aren't able to actually ensure that people aren't sharing that 2 meter distance, then you probably should be putting barriers. Or if you have lots of customers or clients that are coming in, you should probably have barriers in certain key areas. Physical distancing, I'm not going to talk about. So the other thing that's really important about keeping your workspace safe is the common spaces. And now everyone knows that we need to physically distance in common spaces, but what people aren't thinking about too is is food sharing. So I've seen people food share since we've relaxed our guidelines. And so really at this time, food sharing, especially if I can give you COVID from my saliva, is very not recommended. And so we actually insist on not having anything that's out for people to share, like a box of Timbits or anything that you have to put your hands into a bowl, because lots of people don't remember to do all of the hand hygiene prior to touching things. And so if we need to bring in things to share, they should either be individually packaged or already wrapped. Because anything that's sitting out too, imagine if someone's from across the room and they sneeze, all of that COVID sneeze is going to land on your open food. So we really don't recommend sharing food at this time. If you do want to do something like that, you can absolutely bring in individually packaged meals or things that can be covered. And if it's an absolute must, which we did address because our staff said that maybe they wanted to have a meal together, that if people are going to be serving themselves from something that's open, that everyone has their own serving utensil, so that we're not passing a serving utensil hand to hand and making that a vector of transmission. So really just all of the policies that you can implement to reduce high contact surfaces. The other thing that people haven't thought about is if you have a dishwasher versus if you guys wash things and put them on the sink to dry, like a drying rack, we actually recommend that people don't leave things out to dry, because again, if someone sneezes in that space, all of those lovely particles are going to land on your where that's drying, right? And then you're going to put it away and someone might eat off of that later. So it's a vector for transmission. So if you need to hand wash and dry and put it away, that's the recommended way. And then we also recommend if there are towels and things for drying or wiping down, all of those things need to be laundered daily. So we're not reusing the towel from yesterday in today's space, because that's also a vector of contamination.
We're switching to disposable paper towel, which is what we did for now.
Yeah, not as environmentally friendly, so we have to think of a different solution, but we just don't have laundry in our office. And so again, people might feel at risk to take laundry home to wash, right? As our administrator might offer to do. I also don't feel comfortable with having our administrator make that sacrifice if they have to bring something home to wash. So
I just want to add, Natalie, because I know that you said it quickly, but I want to add, because this has been an issue within our office, and one of our clients that we're working with is the Canadian Institute of Public Health Inspectors. Please ensure when we say wash your hands, people come in and they use their sanitizer. We have a thing where it's wash your hands, use sanitizer as a second resort, if you're upstairs and you're walking to another office or whatever. But please make sure everyone knows that nothing beats hand washing. Like sanitizing is good, but it's supposed to be a second line of defense if you can't wash your hands. And in offices, I'm assuming we all have sinks. So
yeah. And then cleaning and disinfecting. So the only thing I have to say about that is really just go to the Public Health Agency of Canada. They have a list of COVID approved cleaning solutions. So make sure you're purchasing those. So next slide, we'll just chat about PPE really quickly. Personal prevention is not something that I really focus on significantly because it is the last line of defense. It's what we use in healthcare because we need to touch our patients. In our offices, we haven't recommended that people need to use masks or gloves because we have a really big open space, and we've asked in our training, our goal is to habituate everyone to these cleaning protocols and good hygiene. And so since then, like our team has gotten very used to actually cleaning down all of their workstations, and actually like doing all the hand hygiene regularly between spaces. So that's our main focus. In terms of the actual mask piece, if people are letting, if they want their employees to wear masks, my only piece on that is that reusable masks, absolutely, you can absolutely use those, but people should be washing them every day because once it's been used for one day, that is considered contaminated and needs to be either like laundered that night and reused, or they just have, I don't know, 5 masks a day. As well as disposable, some people have been asking me whether or not they can like sanitize that with like by putting it in the oven. No, disposable masks are disposable. They must be thrown out. We do not reuse those. And then for gloves, so people can absolutely use gloves. We've deterred it from our offices, except for when we're cleaning. And the reason for that is when people wear gloves, they forget to do hand hygiene. And so we've decided to make that decision so that our team focuses on the hand hygiene piece. And then absolutely no to reusable gloves because those are big vectors of transmission. And then the last piece that we have is really just talking about, you know what, we need to have a safety plan as per WBC, but we also have to think about this plan should also apply to like exposure. So we know that a second wave is coming. So I'm just putting in a reminder that we need to actually consider how do you guys respond to a possibility that someone did come in with symptoms to the office space, or we find out that someone did test positive for COVID. You need to decide as a company and a business, like who's going to be responsible for one, receiving that information, being the designated COVID response individual, who's going to track, you know, the interactions that happen that day, and then who's going to have that conversation with your staff about, you know, what are we doing to be safe? And so we've addressed a piece of that in our policy, but we actually have an exposure control plan that that addresses like, you know, what is our response going to be? Because we know all public health is going to try to do some of that contact tracing. In a second wave, it will take time, and sometimes that contact tracing is delayed. So sometimes notifications can be delayed by like a week. And so sometimes what you rely on is for your employee to say, hi, I got a call and I actually tested positive from COVID. And you might not hear from public health for a week, depending on what the volumes are. And so when you get that call, you have to decide how you're going to actually talk about that if you think that people have been exposed and if you think people are at risk of infection, and how do you monitor for that and keep people safe. And that's, I think, all I really have other than the resources, I think, at the end. Yeah. Does anyone have any questions?
We did have one come in online. It was curious about how to juggle employees who don't believe in COVID-19 to the other extreme, where they are very concerned and want employees to sign a waiver if they want to come into the office, and of course others who are in the middle of that spectrum.
Mm-hmm. I'd like to answer the one, Natalie, and then I'll let you answer the other extreme. For me, if someone doesn't believe in it, that means they're not taking any precautions or risks in their life. They are not allowed in the office and they have to work from home. And that doesn't have to be like a hard thing. It's just a conversation that we understand that, because what we have measured as people who don't take this seriously are also not taking precautions seriously. So they're putting everyone at risk. Doesn't mean that we can't try to work with them, not judge them, try to help educate them and figure out where they're coming from and support them when they're at home. This isn't a punishment. It's something that we work at. And maybe Nat, I'll let you talk about the other extremes. I know you've been doing a lot of that work. And hello, Dustin's little guy.
In terms of like having ensuring that there's a waiver for
someone who's really
liability?
extreme, who's really, but also the extremities, like someone who's really
well,
concerned,
so
some of the strategies you've done.
Yeah, so some of the strategies for people who are like so anxious that they don't want to come in. I mean, to be honest, like that is actually engaging them to help put in some of those policies. Like that's really how most businesses have overcome it. I've helped a couple of other people just have open conversations and walk through their fears, because most of the time when people don't want to come back, it's fear-based, and there's reasons for that fear, whether or not they have an elderly parent that they are the primary caregiver. Those are very reasonable things for people to be afraid about. And so it actually requires one-on-one conversations and an understanding of where people are coming from, and a lot of empathy and compassion at this time, because it is a very tough time for everyone. In terms of the waiver piece, so are you saying in like this for offices making people sign a waiver?
No, they're saying that if an employee is so extreme that they're asking for individuals to make other individuals sign like waivers. Is that correct, Ian? Is that the question?
Yeah, that's what I read from the question. So but I interpreted that as being like very, very concerned and wanted like
I think it's the measures, Nat. And I also wanted to add too, I think what my experience has been, and what Nat and I always experience working in public health, and Nat and I met many, many moons ago, and I've been working in the field 15 years. I started in HIV over 15 years ago. So this is not new, this idea of lack of information or lack of understanding. It breeds fear and stigma. And so I think that the fear often is based on people really not understanding the science and understanding that even though coronavirus is deadly, it isn't hard to kill. A simple 2-minute hand wash will kill the virus. So I think it's this idea of getting people to understand risk and using those Q&A opportunities. I think a physician, we're so blessed to have Natalie, but our clients have also been using Natalie as a physician Q&A time because it really helps people ask all those questions that are creating that fear. Usually for me, it's a lack of information.
I see that there's another question about whether or not additional measures recommended, like immune boosters. So we currently aren't making any particular recommendations for like medications or supplements that can boost the immune system, only because there isn't a lot of evidence. There's not necessarily evidence, but there's not a lot of research around whether or not immune boosters truly exist. I know some people take zinc, some people take vitamin C, and my thought as a physician is I always let people know is if you generally take immune boosters like a vitamin C supplement or a zinc supplement, and that is something that you do in your practice or something that you believe in, I think that's okay. And it might provide some level of protection, but it's not something that we're recommending across the board because it's not something that we can officially recommend. Most of the recommendations we have are really just the hygiene pieces, is wash your hands and try not to touch your face. That's what we've been doing for influenza, for norovirus, for pretty much every other infectious disease that we know about.
Sounds good. I think we have time for just one last question before we get into the wrap up. And it was Alicia saying, can you talk a little bit more about exposure policy? So any more goods there that you've got for if somebody gets exposed? What should you do?
Yeah, absolutely. So so in terms of an exposure, if someone tests positive in your office, so the first thing is to have a conversation with that individual, because unfortunately it's a public health thing, and if they're switched to working from home, it's going to be very obvious who tested positive. So one, it's really important to address that privacy piece and let them know that you are going to talk to the staff about it, maybe invite them to join you to actually have that conversation if that's appropriate, so that people aren't blaming because I think that's a big thing that people often blame and say, you brought it to the office. That's not what this is about, because anyone could have gotten it from anywhere. The second thing is, so at a baseline, what we do in healthcare is that we actually notify everyone as a team, like whether or not it's virtual or spaced out. And we actually let them know that if this is who tested positive, this is the day that they tested positive. So they were in the office for these number of days. If you had an interaction that was within a 2 meter space for more than 5 minutes, you need to wear a mask for 10 days until symptoms develop, just in case you could have been exposed. And then really whoever is your COVID responder should be actually documenting and tracking that as per Workspace BC. That's actually really important, because you also want to know those number of interactions. And by the time public health gets to you, they'll already have some information to work with on helping you and supporting you guys and keeping people safe. But the number one thing is really just kind of figuring out if it's that day, are there areas that you need to do a secondary sanitization, closing off that area just so you do a full clean of that person's workspace if it's shared. And then as well as just making sure everyone feels okay about it too, right? Because the moment you find that out, there will be a lot of people who are like, well, I'm going to go home and I'm scared. So you have to have those conversations about, if you're wearing a mask, generally you should be okay, but it's really addressing those pieces.
I know we're out of time, Ian. I just want to say 2 quick things to finish it up. That it's going to be individual. There's also a lot of responsibility about if any of your employees have come in contact with clients or other people. So there's contact tracing, of course, it's public health. But then also additionally, I think it's important to look at each plan and customize, and that's something that we can offer as well as a service to individuals. So I think it's looking at the template and figuring out what's going to work best for your team, especially on size.
Sounds good. You can see that I put everyone's contact information up on the slide. I'm going to leave it there. I had another couple of slides, but I'm going to leave this there because I know that people are having to leave and maybe have some follow-up questions. So if you need to talk to Natalie, Brandy, Bronwyn, myself, Colin, or Keith, there's our information. We're all open to receiving your comments and questions. We have more of these quarantine chats coming up. The upcoming one, I did get a date on the cybersecurity one because I know a lot of people are looking for that topic, how to stay safe online as we're doing a lot of remote working. So you'll see that announcement coming out soon. Colin's got the What Keeps You Up at Night sessions going on Tuesdays and Thursdays. That's going to start in about 30 minutes if you want to join one of those. I have to wrap, so I'll just say thank you very, very much to everyone who joined, everyone who asked questions, everyone who shared about the quarantine chats with your community. This is really impactful when everyone comes on board and asks questions and comes together to solve these problems. And I'm so happy to have the support of Colin and Keith and the whole Startup Canada and Spring team on helping me to get this message out. Really, really thankful for Natalie and Brandy joining our call today, and of course Bronwyn for giving all that sage advice about HR. So and not forgetting Dustin. So thank you everybody for coming on, and we're looking forward to seeing you again next week on Tuesday for the next thing. These slides are available on our website. Same link that you found this quarantine chats on. We'll post the resources and links on that so you can find your way back there quite easily. And that's it. I'll stop talking now. Thank you very, very much.
Thank you,
and
Ian.
enjoy the rest of your Tuesday.
Bye, guys.
Thank you.
Everyone.
Bye.
Bye.
Bye-bye.